Hi, hello everyone. Welcome to discussion of Drunkenness Certificate. As you know, it is a very important exercise in your FMT practicals as per CBME curriculum. In this video, I'm talking about what are the parts of the Drunkenness Certificate, how to write correct Drunkenness Certificate, especially the opinion, common viva voce questions, and format for sending blood and urine for alcohol estimation. Okay. What are the components of drunkenness certificate? In CBME, it carry 10 mark. The components basically involves general particulars like name, age, sex, and address. It carry half mark. Alleged history, like example, history of road traffic accident. That carry around 1 mark. You need to write a brief history. Then consent. Then marks of identification. General examination. Examination of muscle coordination. Injuries, if any. Systemic examination that carry half mark, collection of materials for analysis that carry 1 mark, and opinion along with the signature and designation. That is a very important component. This is the common area you tend to do mistake. Let's discuss drunkenness certificate, how to write. So this is the common drunkenness certificate which we follow in forensic at Subbaya Medical College. Drunkenness certificate, in the beginning, all the preliminary details, OPD number and IPD number, MLC number, that is the medical legal case number, name, age, sex, address brought by, consent, can take the written consent, but in some cases, consent is not required if he is an arrested person. Sometimes can apply a reasonable force also. Whether person is under arrest, yes, we can write yes, no means date and time of arrest, that is important, date and time of examination. It is all related to the metabolism of alcohol, the time that can affect the metabolism. Then identification marks, at least two identification mark like birthmark, star mark, moon, and write. So there are 10 important points in the beginning. The 11th point, so you can write all the details like this, preliminary details. Then also you can write brief history, brief history like stated by the patient if conscious. If patient is unconscious, then accompanied person. You can ask the history of type of beverage, quantity that is taken, time of consumption, the quantity that is 30 ml, 60 ml, 90 ml, okay, small, large, extra large, like that. Consumed with food or not, gargling with the mouthwash can affect the smell, right? Then medical illness, any medical illness, because there are some conditions they can resemble like drunkenness. Example, EDH can resemble like drunkenness, head injury, or diabetic coma. Okay, so there are many conditions. Any illness in the patient can note down. Then comes with the general examination. That is the build, nourishment, height, pulse, weight, BP, and temperature. Then is the orientation, whether person is oriented, disoriented to time, place, and person. Smell of alcohol from the breath, also from the mouth. State of clothing, whether they are disturbed or not. Speech normal. eye examination is one important component. So in general examination, some important point like speech, whether it is normal speech, thick slurred speech, stuttering speech, or behavior which can be confused, aggressive behavior. Because alcohol is a CNS depressant, it affects the higher inhibitory center. When inhibitory center inhibited, there will be stimulation of the brain. Can be an aggressive person, over precise. Then in eyes, you should look for any conjunctival chemosis, present or not, pupillary size, whether dilated or normal, response to light, sluggish response, normal, visual acuity and the visual field, the presence of nystagmus, yes or no, like that. All the points about the eyes you need. So look at this. So this is the one finding in case of drunkenness, can be a nystagmus, can be horizontal nystagmus, vertical nystagmus, when alcohol level is more than 80 milligrams. Yes. Next comes is the neuromuscular examination. Very important component. This component you need to write properly in the exam. Okay. Examination of coordination. That is by using finger nose test, finger test, or you can ask the patient to picking a pencil from the floor. You can ask the patient to walk in a straight line to check the gait. So based on all this, also the reaction time, you can also do the Romberg test. So based on the finding, they are going to decide whether he is under the influence or not under the influence. Sometime in exam they can ask what is Romberg test. You need to demonstrate something. Any injuries, if there, can mention abrasion, bruise, laceration, or stab wound, size wound. Systemic examination like CVS, CNS, RS, for abdomen. For abdomen, there can be cirrhosis, acromegaly. CVS, there can be increased pulse rate, BP. CNS, there can be depressed reflexes. Respiratory system, respiratory rate is slow, whether it is hurried respiration, shallow respiration, deep respiration. All this we can mention if it is there. So this is how we do eye examination. Look for the nystagmus, horizontal nystagmus, vertical nystagmus, eye examination, important component. Also, you should look for any conjunctival chemosis, visual acuity, visual field. Normally in alcoholism, the pupil is, but remember, in case of alcoholic coma, pupil is constricted. So, horizontal nystagmus or vertical nystagmus. Look for nystagmus in the patient. Here it looks, well, there is no nystagmus. Sometimes you can ask the patient, walk and turn test. This is walk and turn test. Whether he is under influence, not under influence, that can be determined. Here it is normal, he is not under the. Okay. Then finger nose test, finger to nose test. Whether it is normal, Normal means such is accurate. This is finger to nose test. It is also affected in case of cerebral disease. This is Romberg test. Romberg test. If there is a swaying is there, then that is abnormal. Loss of balance when eyes are open or closed. So that is abnormal. Test results Romberg test. Whether Romberg test is positive or it is negative. If Romberg test is positive, then he must be under influence of alcohol. Then one leg stand test. Again, to check for under influence or not. All these are the different tests you can conduct, determine whether the patient is under influence or not. So then finally the collection of materials for analysis, usually the blood and the urine. Then how to give opinion? So opinion can be of three, any of the three. Like example, there is nothing to suggest that the person has consumed alcohol. The person has consumed alcohol but not under influence. So he has taken alcohol but not under influence. Or consumed alcohol under the influence of alcohol. Need to write opinion like 1, 2, or 3. Then finally place, date and signature and your designation, registration. Like Dr. Manjunath, Professor, Forensic Medicine, place, Subaya Medical College, like that. How to give opinion? That is what important here. How do you give opinion in case of drug? Opinion one can be person has not consumed alcohol. So, when there is no smell of alcohol in the breath, no smell, chemical analysis reveals absence of alcohol. All clinical findings are. Then you can give report. Person has not consumed alcohol. That is opinion number one. Option one. Option two. Person has consumed alcohol but not under its influence. When there is a smell, when the smell means definitely there is a consumption. Congested conjunctiva shows that there is a dilated pupil. So chemical analysis reveals presence of alcohol, but clinical examination normal finding. Normal it is, not under the. In that case, you consumed but not under influence. So it all based on the clinical examination. Okay. Person has consumed alcohol is under its influence. When there is a smell of alcohol in the breath, congested conjunctiva, dilated pupil, then abnormal findings, clinical exam that shows that he. So what is the format for sending blood and urine for alcohol estimation? You need to send the sample to the forensic laboratory, name of the hospital, where medical college, to deputy director, regional forensic science laboratory. You write all the details, crime number, position. So the subject is chemical analysis for qualitative and quantitative. What are the samples to be collected? One is the blood sample. How much is the blood? 10 ml of the blood, venous blood, in 100 milligram of sodium fluoride. Sodium fluoride inhibits enolase enzyme, and potassium oxalate, which is a anticoagulant. Date and time of collection. Then urine. Two samples of urine. First sample 30 ml of urine. The second sample that is collected after 30 minutes after the initial. Preservative is few crystals of thymol per 1 ml of concentrated hydrochloric or 10 ml each. Okay. Then the face and signature of doctor. So this is the vacutainer, which is used in the collection of the samples from the patient. Then some viva voce question. This question can be asked. Define drunkenness. What is drunkenness? Asked. The drunkenness, according to standard textbook, it's a clinical condition produced in a person who has taken alcohol in a sufficient quantity to cause him to lose control of his mental, physical faculties to such an extent he is unable. This word is important. He is able means it's not drunken. Unable to do or execute safely the occupation in which he is engaged at particular time. This is the definition of drunkenness. The second question can be asked, what is the legal limit of alcohol in India for drink and drive? The answer should be 30 milligrams. One more point, alcohol is a poison. What type of poison? It is a CNS depressant. It is a cerebral neurotoxic, sedative, hypnotic. It is also known as inebriant. So among all socially acceptable drugs, legal drug, so that is socially acceptable, third most common drug of abuse, that is alcohol. First comes is the caffeine, second is the nicotine, third one is the alcohol. Is it necessary to take consent from a drunken person arrested by police? He is arrested by the police. You can take consent and examine, or according to 53 CRPC, clearly mentioned that examination of accused by medical practitioner at the request of police officer. When there is a request of police officer, you can examine even without consent, even with reasonable force can be applied to examine him. This is the how do you give opinion in case of drunkenness? Did we discuss that? What is the differential diagnosis of drunkenness? Head injury like extradural hemorrhage, hypoglycemia, uremia, vertigo, epilepsy, drugs like morphine, antihistamine, insulin, carbon monoxide. All these are the differential diagnosis that should be ruled out during exam. Even carbon monoxide poison can resemble like drunkenness. What is the statutory limit of blood alcohol concentration? Answer should be 30 milligram percentage. What is the punishment that can be asked? According to recent amendment, 2019 Motor Vehicle Act amendment, for the first offence, it is 10K fine, 10,000 fine, and 6 months of imprisonment. For the second offence, 15,000 fine, imprisonment up to 2 years. So this is what mentioned in Motor Vehicle Amendment Act. The answer like this, that is more than sufficient. What is section 202, 203, 204 of Motor Vehicle Act? 202, that is related to the power to arrest without warrant. So, police officer in uniform may arrest without warrant any person who is in his presence commits an offence punishable under 184, 185, 197 of Motor Vehicle Act. 203, that is related to breath test. Deals with the breath test to be conducted by a police officer on a drunken person. If suspected person refuses to undergo breath test, police officer may arrest him without warrant. This is what 203 that states. 204 that related to laboratory. It deals with the laboratory blood test of a person who has been arrested under 203 by RMP. Doctor can examine such arrested person without consent under 53 CRPC by applying reasonable force if needed. So all these are important point. Answer like this, examiner will be very happy. In simple word, 202 power to arrest without warrant, 203 related to the breath test, 204 related to laboratory. What are the various stages of clinical features of acute alcohol intoxication? As you know, there are three stages. Stage of excitement, 50 to 150 milligram percentage. There will be euphoria, excitement. Stage of incoordination, there will be disorderly behavior and stupor. Is between 150 to 300. When it is more than 300 milligram percentage, there can coma and death. The question can be asked, what is McEwan's sign? McEwan's sign is a test to differentiate alcoholic coma or coma due to other causes. What are the tests to detect muscle incoordination in case of drunkenness? As we discussed before, gait, Romberg test, finger to nose test, buttoning, unbuttoning shirt, walk and turn test, handwriting, stand on one leg test. All these are the tests. So, in case of drunkenness, check or to detect incoordination muscles. What is McEwan's sign? Is seen in alcoholic coma more than 300 milligram percentage. So, normally in alcoholic coma, pupil is considered. On stimulation, tapping, pinching, pupil is dilated and returns to normal size slowly, which is known as McEwan's sign. See here, dilated pupil becomes dilated after stimulation is one important finding seen in case of alcoholic coma. And last question, they can ask you, what is Wigmore formula? The Wigmore formula is for ethanol estimation. A is equal to P. What do you mean by A? Amount of alcohol in the body. P for body weight. C for concentration of alcohol. R for constant. Males, the constant is 0.6. Females, it is 0.5. So females, the constant is because females water content is. So alcohol is a water soluble poison. And the last question you can answer in the comment section. The person, a 50-year-old, arrested by police officer for his misbehavior at the public place. On examination, there is a smell of alcohol from the breath, mouth. Muscle incoordination is present. Romberg test is positive. Blood alcohol level is 50 milligram percentage. Your opinion about certification of option A, person has not consumed alcohol. And B, person has consumed alcohol, not under influence. You can see person has consumed alcohol. The option D, auto brewery syndrome. Write your answer at the comment section. Also, you write what you mean by auto brewery. So that completes the drunkenness certificate. If you have any doubt, you can write in the comment section. Thank you.